Ellis for 5 minutes, please.
Thank you, Mr. Chair. And just as a heads up, some policy questions, whoever might want to answer them. Unvaccinated travel on a federally regulated boat in Canada, is that permissible? Simple yes or no.
Mr. Chair, this is Harpreet. The question, if I heard correctly, is it that unvaccinated on the boat, they are they permitted or not? Sorry, I'm just asking.
That's it. That's it, Doc. You got it.
Yeah. So at this point, any unvaccinated on a boat is not permitted, specifically entering into Canada.
What about a ferry there, Dr. Kochar?
In terms of the border measures which we currently have, I think
inside of Canada, there, Doc.
On a ferry in the Canada waters, there is no such restriction as such.
Sorry, so unvaccinated people can get on ferries inside Canada. Is that what you're saying?
Unvaccinated people, if they are traveling in between the different cities or different entities, I think that is where we actually, maybe I'll confirm this, Mr. Chair. I think they are. They're permitted to get on, so long. I'll get back to you, Mr. Chair. I want to confirm that I'm giving you the right answer. Sorry.
Okay, well, I'll move on. Same policy stuff. Unvaccinated travelers by air, permitted? Yes or no? Simple answer.
Again, domestic?
Yep, domestic.
So on the domestic side, we don't allow the unvaccinated to travel on planes.
Yeah, well, I guess maybe I'm a policy expert now, but oddly enough, you can get on a ferry inside of Canada unvaccinated, and you can get on a plane unvaccinated from remote northern communities. You can do that. So I guess this is going to make this very, very difficult for you to answer this question since you didn't know the policy, but how does the science apply
Point of order,
to
Mr.
other
Chair.
people that doesn't apply to these folks?
Go ahead, Mr. Van Couverden. A point of order.
Thank you. I think we'd all agree that we're fortunate to have officials here with us, and my colleague is addressing the President of the Public Health Agency of Canada. I think a little bit of respect is due. Thank you.
On that point of order, Chair?
Yes, go ahead, Mr. Barrett.
Chair, on a quick review of the rules, Mr. Van Couverden's intervention is not a point of order. It's a point of debate.
Thank you, Mr. Barrett. Dr. Ellis, you can take whatever advice you want from those comments, but you have the floor. Go ahead.
Yeah, thanks, Mr. Chair. You know what, I just find it somewhat distressing that the head of one of Canada's agencies doesn't know the policies that his agency creates, and also it makes it very difficult to understand the science that directs such policies when you don't even know the policy. So given the fact that unvaccinated Canadians are allowed to travel domestically by air and on ferries, how does that science apply to anybody else in Canada who is unvaccinated, say from my riding of Cumberland-Colchester, which is in Nova Scotia? How can they not get on an airplane if certain Canadians can? What is the magical science that exists for certain people that doesn't exist for others in Canada? Please explain that to me, sir.
So, Mr. Chair, maybe I'll come back to this question in a way that certain populations are exempt for travel for essential purposes, and that is an exemption. Discretionary travel is not allowed for foreign nationals on a plane, not unless they have an exemption as such. Domestically, you cannot get on a plane by air. And that is the case. And if you have a right of entry internationally, you can get on the plane, and that too with a test and then further day 1, day test, as well as quarantine. So those are the main frame of the rules, Mr. Chair.
Thank you. And Dr. Kochar, through the chair, please, what do you determine as essential, and who determines that?
So, Mr. Chair, for the essential purposes, we have described them as those who are in certain sectors, for example, healthcare, oil and gas, and others. And there exist some other exemptions which are specifically related to maintaining the supply chain. So they're considered to be essential. There's a definition, and that is how we actually treat them.
Thank you for that. And Mr. Chair, a couple of more questions.
One more. Great.
We spent about $2 billion on rapid antigen tests. How many of those are still on the shelves and gone stale dated? And if you don't know the answer, great. I'd love that to be provided and tabled here in the committee in the next 2 weeks, please.
Mr. Chair, I'll respond to that question. Health Canada, working with provinces and territories and other suppliers, have had a very careful inventory management to avoid expiration of tests. This has been managed very closely, including working with manufacturers, taking a life cycle approach in terms of being able to ensure that inventories are updated. So this is an area where we take every step needed to minimize the risk of tests reaching an expiry date.
Thank you, Mr. Chair, but I'd like to clarify. I asked specifically for a number which wasn't provided, and then I asked that evidence to be tabled here in the committee, please. In 2 weeks.
We can follow up, Mr. Chair, with specific evidence, but I stand by my response that every effort is taken in terms of the 600 million tests that have been acquired and distributed and used in Canada to ensure that they don't.
A quick question for Dr. Tam. Am I correct in hearing that you said 3 doses of the vaccine is about 60% effective?
Thank you for asking for that clarification. So 3 doses of vaccine against infection and symptomatic disease. When you begin soon after you get that 3rd dose is about 60%, but the studies range in their estimates. And for severe disease is over 90%.
It's interesting, Dr. Tam, it's just a comment, but for varicella, the mortality rate about 21 people per 100,000 in adults, and a very perhaps more effective vaccine was supplanted by another. So I find it unusual we continue to recommend this vaccine that's very poorly effective. Anyway, that being said, interestingly enough, masking mandates are stopping in Ontario on public transit and in also other various healthcare settings except long-term care homes. So I wonder, does Dr. Moore have some metrics that perhaps he needs to share with the Public Health Agency so we could have some numbers here? Would that be helpful to the Public Health Agency of Canada?
So I would answer that the requirements for domestic transportation is in the domain of the Minister of Transport. And whether someone requires you to wear a mask or not, I would recommend that people add on that layer of protection, especially if the viral activity is high in your area, whether someone's requested it or required it or not.
So Dr. Tam, are you suggesting Dr. Moore is wrong?
I didn't say that. I mean, in terms of the local jurisdiction, they will know more than I do about the disease activity. But for the general population, I still advise people that to layer on that protection, particularly if you're at high risk, and to protect others.
Interesting comments. Thank you for that. Mr. Chair, to Dr. Tam again, if I could. You know, we talked a lot about metrics and numbers, and I guess I have a very pointed question. What is it that makes the Public Health Agency of Canada afraid to share those numbers with Canadians? What are you afraid of?
I think it's a question of people need to understand the complexity of public health decision making, and you cannot make these very complex decisions based on a singular metrics. The decision makers have to take into account a number of metrics. Even looking at healthcare capacity, that is different across Canada. It's not the same between Yukon and Ontario. And as the federal government, they need to take into account and make sure that they're protecting all populations across Canada with some of the mandates that they are responsible for. So you have to look at a composite picture of all of those metrics that or measures that Dr. Harpreet Kochar had mentioned. It's not that simple. So you cannot boil down a complex decision by simple metrics, but all of them are important.
Yeah, Mr. Chair, thank you. Thank you for that, Dr. Tam. Mr. Chair, if I could, oddly enough, we've asked for those metrics to be presented here at this committee, and again, not to be disparaging to my other colleagues, but there are 3 physicians on this committee, and again, Public Health Agency of Canada has refused over and over and over and over and over and over again to provide these metrics. I would dare say that perhaps, 3 physicians might be able to understand this very complicated stuff that you're talking about. I find that utterly shocking, dismissive, and quite frankly, unbearable that you continue to refuse to provide this. And there has to be some metrics, Dr. Tam. I mean, this is utterly ridiculous, and to not provide them to this committee is quite frankly embarrassing.
As far as I know, the Public Health Agency, as part of the remittance from the last committee, provided the answers that this committee was looking for, and the president of the agency has...
I'm sorry, Dr. Tam, that's absolutely untrue. I'm the one who requested that material, and the stuff that we got talked about, the same foolishness, and I'm sorry to be disparaging to Dr. Kochar and to the minister, but the same foolishness that we hear over and over again, that vaccines are very helpful. Yes, they are. We're fine with that. Tell us the metrics. Simple. Unbelievable. This is unacceptable, Dr. Tam.
Dr. Tam, you go ahead and respond to that, and then we're going to move on to the next questioner.
I think the metrics are what they are. We're looking for specific numbers, and it's actually really difficult to do that because you have to take into account all of those metrics at the same time. And I think they do include what I've actually talked about, which is vaccine effectiveness, of course. So the current 2-dose vaccine regimen is not enough. And so as chief medical officers, we said up-to-date vaccination is what we recommend. And the other metrics, if you were looking at it, would be the pandemic activity across the world. The United States still going up. Canada, the current wave has come down. That's great, but the hospitalization is still high. And it depends on where you are. So I believe those kind of information had been provided to this committee, but we can certainly follow up.